All right, so this is prompt number 3 for cardiac physiology. This is looking at if you're working at your dream job, yay, uh, and you're working with a client who had a myocardial infarction in the past, who underwent bypass surgery and is taking a diuretic and then also has an emergency vasodilator drug. I'm assuming just in case he starts to um, have onset of angina, right? So having chest pain, ultimately, and they're going to take this emergency vasodilator to hopefully not get a heart attack, right? Especially with their experience, once they start to feel those pains, instantly going to want to take that emergency vasodilator, causing nitric oxide to build up, vasodilation, allowing blood to go through smoothly to where it needs to go. So hopefully, if there's a blockage, take that vasodilator and you'll be okay. Prevent a heart attack, hopefully. So looking at some things to some precautions with exercise, ultimately just not maybe pushing their intensity levels too high, right? You don't want to overwork them, especially if they're taking a diuretic. Ultimately, you're pretty much going to be lowering their blood volume, right? Through excess urination, you're dumping out, you're peeing out as much as you can, whatever the diuretic is pushing your body to pee out, I guess. So you're going to be lowering blood volume. The problem is when you have lower blood volume, you have lower cardiac output. You have lower cardiac output because your stroke volume went down, and your stroke volume went down because you have less preload. When you have less preload, you're going to have less contractility because of the stretch, squeeze, Frank Starling mechanism, right? So less blood volume, you're filling ultimately the ventricles with less blood, so you're not stretching it out more to get a more myosin actin cross bridge. So if you don't stretch it as much, right, I'm only stretched out here, that's all I got, instead of fully stretching with the right amount of blood volume and getting a full contraction. So you're having less strong contractions and ultimately really less preload. So the thing with exercise, your body might not be able to keep up with that work demand and nutrient delivery because you have less blood volume. You're going to have less venous return, less preload, lower stroke volume, lower cardiac output. You're not going to be able to work as hard to meet those demands. So with this client, you're going to want to keep them on more of like a moderate type intensity level for their exercises. So that's definitely one of the main precautions of a client. And I guess maybe just not overworking their heart. So don't do like insane cardio for the whole entire workout just because of the heart rate being high at a long intensity. Rather make sure you have like proper rest, those sorts of things, and constantly communicating with this client. So ultimately too, I guess I kind of answer that question, but being able to tolerate exercise, their tolerance is going to be lower based on their cardiac output going down because of everything I explained, just with their low blood volume because of the diuretic, not being able to meet those work demands to bring oxygen to the working muscle. So some things happen too when cardiovascular effects to exercise. First things, we're going to see an increase in cardiac output, like I talked about. So your heart rate's going to go up, stroke volume's going to go up, or it's going to need to go up to meet these work demands. So you're going to increase your systolic blood pressure because that pressure hitting those arterial walls are going to be at a higher frequency, and it's going to be more forceful because your heart's pumping harder and faster at a more frequent rate and pushing out against the aorta and hitting those arterial walls harder. So you're going to have just a higher systolic blood pressure based on that cardiovascular effect of exercise. Next, you have like your mean arterial pressure increases, your pulse pressure increases, which is going to make your cardiac output be higher than that vascular resistance. And then you have you want to keep your central venous pressure maintained, right? Ultimately, you want to do that because you want to be able to drive blood back to your heart, to keep preload up, to keep cardiac output up, and you kind of keep your pressure maintained by venous constriction, your muscle pump activity, and then your like your what's it called? I can't even abdominothoracic pump, right? So you're driving more blood into those lungs so you can you can get oxygen to the blood and then pump it out to deliver to the body. So those are some 4 things that happen, those cardiovascular effects of exercise. So another thing too is that there's a process really that happens. Like you start to increase rhythmic contraction. That leads into an increase in the skeletal muscle pump, which increases in your preload, which increases in cardiac output, which increases in your blood pressure. Then you have the products of metabolic waste, right? Increased hydrogen ions, lactate accumulation, those sorts of things build up. So now your body's like, uh-oh. So since those metabolic processes increase, you're going to want to vasodilate in those regions. So if I'm blasting my legs, I'm starting to get that metabolic waste built up in the working muscle, because that's where contractions taking place. So my body's going to vasodilate to those working muscles and vasoconstrict to like the gut and the brain. This way, you're really needing blood where the working muscles are. You're needing that gas exchange. You're needing to deliver muscle or deliver oxygen and those rich nutrients to the working muscle, to the working tissue. And then you're going to want to take away those metabolic wastes like the lactate and hydrogen that's accumulating in the working muscle because of you're just destroying your muscles. You're running through glycolysis, your glycolytic, taking that pyruvate and now running it through the Cori cycle to make glucose as fast as possible. But we know we accumulate hydrogen ions and lactate from the Cori cycle because you're turning pyruvate into lactate, and then you're using lactate dehydrogenase and creating hydrogen ions and lactate accumulation from there. But that's other stuff. Where was I? Yeah, so when you start to increase and vasodilate, you're also sending signals to the brain. So you get sympathetic activation, norepinephrine comes in, epinephrine comes in from the adrenal medulla. That's when your gut constricts. So your body is just trying to protect itself, knowing that blood doesn't need to go to those regions, it needs to go elsewhere. And that's also going to kind of help protect that systemic vascular resistance. This way we're still getting enough blood so we don't pass out, those sorts of things. So that's ultimately the cardiovascular effects that are going to occur with exercise. And of course I talked about just being cautious with that client, just knowing their blood volume is going to be lower. Also, if they're starting to have chest pain, they're going to have to take that vasodilator because maybe they're suffering from angina or cardiac ischemia, and they're not getting the right nutrients to their heart. So hopefully with vasodilating, they're able to get more blood back into that heart. But you just got to watch out if or when they're working out. Just monitor them, knowing that their cardiac output, they're not going to be able to tolerate exercise as well as they or a normal individual would. So just not overworking them, keeping them to moderate intensity, and just monitoring them overall.